It's tough because it gets to the confidence of our caregivers.
But now at 5, it can be a dangerous job. We're digging into a renewed focus on protecting doctors, nurses, and other healthcare workers as they help patients. Good evening to you at 5 o'clock. I'm Mark Mullins.
And I'm Nicole Griffin. Healthcare workers say it's a challenge to focus on saving lives when their own lives are at times in danger. WRTV's Rachel Wilkerson shows us a new plan to make sure they're safe and sound.
Attacks continue to rise in Indiana hospitals. The newly launched Safe and Sound campaign reminds patients that violence will not be tolerated.
Caregivers, sometimes they kind of see that as their lot in life. You know, they took this job and part of the job is that they become the victim of aggression. We don't believe that's how it should be.
When patients enter the hospital, they rely on healthcare workers to help them. But as we've reported, caregivers often become a victim of violence.
And we're the folks that we perceive ourselves as being your helpers, and yet we're the victims more than any other industry combined.
Ginger Breek is the executive director of patient safety at Community Health Network and monitors assault reports. She's also a registered nurse. She says reports of attacks, both verbal and physical, vary.
It covers the gamut. One of the things that's probably very underreported is the verbal aggression, and so we really are working with our staff to recognize that if somebody makes a threat to you or they intimidate you by calling you names. The other things we do see are we see physical aggression. We have folks that punch, that kick, that spit, that, as I said earlier, it involves throwing bodily waste. All of those things, those are aggression too, and no one should be a victim of that.
The Indiana Hospital Association recently launched its Safe and Sound campaign with banners in all hospitals stating safe caregivers means better care.
It's very hard to focus on the safety of a patient when you're in fact focusing on your own safety and you're in fear that you're going to be assaulted in some way.
Last year, IHA raised the red flag about the rise in hospital attacks and the lack of punishment. It fought for the General Assembly to pass a new law. As of July of this year, assault in an emergency department is a felony.
That makes us feel a lot safer. We don't want our nurses or our support teams to come in here fearful of what the day may bring to them.
The 5 hospital areas attacked the most include the ERs, intensive care and behavioral health units, medical checks, and security. Breek says while hospitals are taking steps to better protect employees, remember this.
Be strong. There's a reason you went into health care. Folks went in because they have a desire to help people, and that desire doesn't go away. And so get help.
Rachel Wilkerson, WRTV.
Nurses we spoke with today say attacks are underreported. The Indiana Hospital Association stresses that the new law is a step in the right direction to reduce violence in hospitals, citing the harsher penalties that hopefully will help crack down.